to see a case study video. So what is a case study video? Actually, I have seen a case regarding the frozen shoulder and what are the improvements which we have made in our physiotherapy. So today we are having our mentee, Mr. Sabish from 3rd year BPT. So he is going to demonstrate, and with his help I am going to tell you what are the possible things which is emphasizing the treatment of the frozen shoulder. First of all, the frozen shoulder patient cannot able to lift their arms. So how cannot they able to lift their arms? So if I am asking a patient to lift their arms like this is a normal thing they can able to do onto the stride flexion. Now onto the side flexion, they can able to lift like this, only to this move. But the normal abduction is up to this area and the normal flexion is up to this area. So this much of normal ROM has been limited. Why it is limited? So all the movements which is happening inside the shoulder joint, this area, the capsular area is getting adhesive. What is adhesive? Adhesive is a Fevicol thing, but inside the capsule, all the ligaments, the muscles is getting fixed. So once this area are getting fixed like this, they cannot able to lift their arm onto the flexion and to the abduction. So what we are going to do in our physiotherapy. So as a physiotherapist, we can apply a number of treatment protocols for frozen shoulder case, but a specific protocol should be followed for each shoulder cases. Why? Based on the age, based on the gender, and based on the ROA. All these three categories should be implied. So who and all will get affected with the frozen shoulder? Post-cardiac patients, the diabetic mellitus patients, and long-term no use of shoulder patients will get. That is, immobilization patient will get these types of categories problem. Now, all these categories will be going for a common purpose, that is restricted ROM. Now, as a physiotherapist, I am going to apply certain mobilization. What is mobilization? I am going to mobilize this area. So, what is this area? The head of the humerus and the glenoid cavity of the scapula. Now, I am going to mobilize and I am going to lift his arm. So, these types of mobilizations are very well used in our clinical cases. What can we use for other cases? So, we can keep IFTs, okay, to reduce the pain, and also we can keep the wax bag. Okay, what is wax bag? It's a paraffin wax which can be helpful in reducing the stiffness. So once we reduce the stiffness, we can able to do all the movements. Okay, so all these movements can be done with the physiotherapy exercise. So upcoming to the end of the session, so these types of modern techniques which we can use are mulligan concept, which is very well used. Like we can apply a belt, that is mulligan's belt, onto the shoulder area. Then with this mulligan belt, we can able to mobilize the shoulder joint. So advancement of physiotherapy is on a higher purpose, but as a physiotherapist, we need to concentrate both for the low and also the advanced. All these techniques should be in our fingertips to help the patient to rehabilitate from the stiffness of the shoulder joint. So with this, we are completing the case study video of the shoulder joint, that is the frozen shoulder. Hence, we can see in next video regarding the other diseases and other questions. Thank you.
Why are there not more people talking about frozen shoulder? It sneaks up on you and limits everything. Here's a quick fix to start loosening it now. Stand tall. Pendulum swing your arm gently for 10 seconds. Then do wall crawls. Fingers walk up the wall for 10 seconds. Finish with a towel stretched behind your back for 10 seconds. Repeat twice daily. Breathe through it and check with your doc if it's worse.